Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Graca and I'm a licensed acupuncturist. Today we're going to approach this vlog in a little bit of a different direction that we normally would go to, because this time this is really directed to the general public and patients, and also having a little bit of information there for GPs, other healthcare practitioners, because this time we're going to talk about endometriosis. So this week is Endometriosis Awareness Week, and there's been a lot of events going on, and I wasn't actually really planning on recording anything about it because there's other people doing amazing work out there, and you've also seen that there's been loads of news out with the vlog, so it was kind of like hard to put everything together into 1 week. But something really caught my eye this morning, and I thought, hey, let's record a vlog and let's inform the public. And what I want to talk about is a guideline that was published, and it's called Information for Women with Endometriosis, and it's from the European Society for Human Reproduction and Embryology. Siobhan and I are proud members of the organization. We really like to help and really back them up on what they're doing. They put out an amazing amount of information. If you remember from one of the previous vlogs, I'll leave the link up here, but that was actually how we got to know about the study on acupuncture for IVF, because the abstract was presented at one of their conferences. I'm not sure if it was the one this year or the year before, but anyway, the link is up there so you can go and check it out. And this particular one, it being the Endometriosis Awareness Week, Information for Women with Endometriosis, patient version of the ESHRE guideline on management of women with endometriosis. Like, the reason why it's kind of worded like that, in being the patient version, is just that it's a little bit less jargon, technical terms used than the one for medical practitioners. So that's the only reason why I'm picking up that one, because that's probably the one that patients are going to read. So I'm going to mainly look at we all know about the medical treatments for it and the surgical procedures and everything. So I'm going to pick up on the one that matters most for us in our clinics and for the public that might be watching this, because after all, it is the acupuncture vlog. So part 8 is the one that talks about beyond usual treatment. And a few key things that I wanted to mention to everyone. I'll leave the full quotes down here. And it starts with: the medical and surgical treatment of endometriosis have been studied widely and are used in clinical practice. We all know this. Since these treatments have limitations, you might have not known that, but there you go. Since these treatments have limitations, this is the medical and surgical treatments have limitations, some women prefer to explore other options. It's simple enough, isn't it? Like, if you have something that is bothering you and the treatments that you're getting are not enough or are not giving you the results you want, you go and you look for something else, right? So, just because of the lengthy next paragraph, I'll leave it down here, but you can just see that what they included in complementary and alternative therapies, which in itself it's a really bad term to use, but let's leave that aside. They actually included acupuncture, they included traditional Chinese medicine, they included herbal medicine, they included sports and exercise as well as a complementary and alternative therapy. That's kind of like debatable, but I just want you to see what's in there. And it says that several of these complementary and alternative therapies are used by women with endometriosis to reduce pelvic pain, dysmenorrhea, improve the chances of pregnancy, and improve quality of life. Now, we all know this from the clinics. We do get a lot of referrals and we do get a lot of patients coming in, a lot of the times referred by their GP, that, they might have had their medical treatment or surgical treatment for endometriosis. Some of the issues that comes with that, or some of the side effects, or some of those symptoms are still there, mainly anything to do with pain, and then they are referred to us for treatment. So we all know this, and I'm glad that it's acknowledged on this particular piece of work. So now I just want to give you a couple of lines for a comparison and how true this is. And again, I'll leave it all down here, so I'm going to read quickly through it. Before recommending a certain type of pain, doctors would like to have some objective data collected in a high quality study showing that a certain therapy is effective and not harmful to the patient. I would argue there that everyone, not just doctors, I do the same thing. If I was giving advice to my next door neighbor or my brother or my friend, I would want to make sure that it's damn well that it's safe, that it's not going to cause any harm, and it's as effective as possible, as we know, because hey, remember the first sentence? Medical and surgical treatment have limitations. So you kind of just go with the best information that you have available at that particular time. So again, it's just a thing with the language doctors would like to have. We all would like to have. So up to now, there is no good proof that complementary and alternative treatments truly help reducing pain or improving fertility in women with endometriosis. That might be depending on what you call good proof. So we don't. That's the bit that I'm kind of left at a miss there, because I don't really know what good proof means, because there is plenty of evidence out there. I just don't know what that's just, it's just a term, so I don't know what good proof means. It's a bit like saying that medical and surgical treatment have limitations, yet didn't really specify what the limitations are. So in this case, maybe they are interchangeable. I don't know. So I don't know what good proof means, so I'm going to have to leave it there. But then what's really important for the patients is when we get to last, it shouldn't have been at the very end, because this is what patients want to know. However, the guideline development group acknowledges that some women who have complementary and alternative treatments may feel benefit from this, meaning that they have improved quality of life and or can cope better with the symptoms of endometriosis. And that is the main key. Number one, patient knows that they can use acupuncture, that they can use traditional Chinese medicine. They put a lot of stuff on that complementary and alternative therapies, even the exercise and sports. But specifically with the acupuncture, we can guarantee, because the studies are out there and we've done loads of work and putting it in proper words that people can understand, that there are limitations. Everybody has limitations. Remember, we talked about that? There are limitations. But when you're talking about those symptoms that go along with the endometriosis itself, cope better with the symptoms of endometriosis is the quote that they have there. And also, one very, very important key is that quality of life. Quality of life for the patients, and that's what we should all be looking for. So the GP or the gynecologist might go, okay, you have endometriosis, you really need medical and surgical treatment, although those have limitations. So can we pick something up that will actually complement that? And that is where the name comes from, isn't it? The complementary therapy. So if one has limitations, the other one has limitations, what if we put the two of them together? Who's going to be the beneficiary of all this? The patient. The patient is going to be the one getting the best treatment, because they are getting the best medical and surgical treatment, and they are getting the best complementary treatment alongside that. And what does that translate as? Just as I say, have improved quality of life and or can cope better with the symptoms of endometriosis. Better quality of life, coping with the symptoms. That's what we should all be aiming for, and that's what we will continue to aim for our patients and anyone from the public who's asking us for information. So, great guidelines, a few things with language that are a little bit, to me, I don't know, maybe it's because I'm a Portuguese native speaker. To me, in English, some words should be a little bit different there in terms of giving the real idea to the patient of, this is what we know so far, it's the best evidence that we have, therefore here's what we can do. And again, I can't say this enough, always considering that together we are better. So anyone has any questions, anyone who wants to get in touch, even if you want to do it privately, please do so through the clinic's website. You can get in touch with Siobhan or myself, no problem at all. Or if you want to leave your comments below, feel free to do so. If there's anything more specific, get in touch. We'd love to hear from you, and I hope this was helpful and that you can pass on the information to friends, family, anyone who you know that might be affected with endometriosis. Please seek help. Always get it checked. Start with your GP. If more tests are needed, if scans are needed, if any procedure is needed, please do so. For acupuncturists, anything like ourselves, and that's why I'm picking on acupuncture, anything that we can do to help alongside that medical and surgical treatment, we're here to help you, and we are looking forward to hearing from you. So until next time, be kind and be healthy.
Oh, baloney. The whole thing always gets back to drugs.